everyone. Today we will discuss about the ulnar bone. First of all, we will discuss about its position. Ulnar bone is long bone which is present in the forearm, and it is broader close to the elbow, and it narrows as it approaches to the wrist. It is parallel to the radius bone, and it is slightly longer than radius, but the radius bone is thicker than ulnar bone. Then we will come to its anatomy. This part of the ulnar bone is known as the proximal part. This is shaft of the ulna, and this is the distal part. This is known as the head of the ulna, and this point-like structure is known as the styloid process. Then we will come to the proximal end. This is the olecranon process, and this is coronoid process. This is known as the radial notch, and it is trochlear notch. The ulnar bone forms part of the wrist joint and an elbow joint. Then the functions of ulna. The main function of the ulna along with radius is to assist with the rotation. This rotation allows for the maximum function of the wrist and hand due to increased range of motion.